See, building in healthcare is hard. It's a messy sector, there are lives at stake, it's slow, there's bureaucracy, and it's also very competitive. So, unless you know where the real opportunity for you to get in is, you will end up wasting years chasing some kind of an opportunity that probably wouldn't click or wouldn't scale. But if you can make it work, if you can make healthcare work for yourself, you don't just build a good business with good margins, you also impact millions of lives. So where do you start? And what really works in healthcare? In this video, you will hear from 4 people who are founders and understand how healthcare works and are working within healthcare across global systems. We talk about prevention.
Believe the entire healthcare system will move towards a proactive system because of this possibility.
We talk about actual care delivery.
Very challenging in this country is that different cities behave very differently. You have to continuously modify it.
And we talk about how the world's hospital system is evolving.
So the three things that I would highlight for you are digital pathology, hospital at home, AI for diagnostics. And those are all implementable no matter where you are in the world.
And where Indian founders can actually make a dent.
The advent of artificial intelligence, machine learning, and technological breakthroughs, and that makes you and your work attractive to people.
So to get started, let's look at prevention. India is living with a lot of chronic diseases, diabetes, hypertension, lifestyle diseases. So healthcare in India is primarily sick care. You get sick and then you get healthcare. Fixing people's diseases or fixing people after they're sick. But now with wearables, how easily data is available and AI, preventive healthcare is actually becoming cheap. It's becoming affordable. So how can we use that to prevent people falling sick in the first place? For that, we talked to Vishal, who's building Gooki, who's working on a technology to solve just this.
Healthcare system is traditionally broken because it is not healthcare. It is sick care.
Yes.
The whole system was designed for people who are sick, who come in and then you fix them and you send them back, but they continue the same habits. And what we are seeing is a country with very high degree of diabetes, cholesterol, hypertension, all non-communicable lifestyle-related diseases. It could be whoever pays for healthcare.
Right.
It's either an insurance company, a government, an employer, or a family. They care about prevention. Versus the system, the for-profit healthcare system, while I'm sure they want people to be healthy, but their business finally is about how many surgeries and how many beds and how many medicines you have sold. I think one very big change has happened in the last 5 years is the advent of wearables and now combining wearable data with AI and with lifestyle data. So essentially, healthcare is going to go from a probability-based model to a predictive model. So the way to think about it is insurance companies who were largely selling insurance premiums and policies used to look at your data and price a policy.
Yeah.
But now, just looking at your health report, they can figure out that what is going to happen to this person. So you know already that, hey, there is a very, very high risk of a very big heart attack or any other event to happen. So now with that information, we believe the entire healthcare system will move towards a proactive system because of this possibility which is now getting unlocked. The point is that I believe that health data will become ubiquitous. If you are a human, you will have a device on you which will give you data. Now, the business is going to be how do you use this data to prevent you from not getting sick.
Right.
So the market in India is actually very large. Just to give you an example, the problem is not the market, the problem is the conflict of interest. So just to think about it, we are in Mumbai. BMC spends $1 billion, 8,000 crores on the health of people in Mumbai. But a lot of that is going to sick care. And those models are incentivized to make sure that you keep getting medicines and you keep getting tests because they make money by doing that. Versus an alternate model where we go to a BMC or we go to a government or we go to an insurance company that, hey, we will identify people who are at risk and we will do an intervention and make sure that they get demedicated, for example.
Okay.
So that's a model. So I think it is very important to understand who your customer is and align yourself to them.
While prevention is great, you can only prevent so much. At some point, people will fall sick. At some point, they will need to get into the healthcare system. At some point, you will have to start the grind of finding beds, and beds are always limited. Building infra of hospital, scaling it to the remotest, places in India. That's very tough in India. So our next guest is building something different. He's been able to bring ICU level care to people's homes. He's building the hospital at home infrastructure for India, which really helps because beds are limited. And how does such a service thrive in India is what we're going to be hearing from him. Let's listen into Vaibhav from Portia. Minimum viable product that you've set up, a minimum viable business. What is the biggest challenge in scaling? Is it just hiring the right kind of people at scale, or is it something else?
So it's basically creating the right unit metrics actually. So especially when you're starting, you say, okay, what's the minimum size at which you can test the unit metrics? And then how do you scale that? So you're right, scaling offers a challenge. So you get a unit metrics going. How do I hire 100 people? How do I train 100 people?
Give me examples of unit metrics.
So for example, if you take a physiotherapist or take a nursing attendant or what we call caregiver is going to patient home, how many visits a physiotherapist needs to do for it to be a sustainable business?
Okay.
Correct?
So they
At
have
what
targets to hit.
Yeah, what price point it has to happen. Now it has multiple problems. It's one thing, of course, they have to do. Second, that you have to get those many patients leads also in that area.
Right.
So if I want to make an Indiranagar model work, I need to get enough visits in Indiranagar organized. So I need to generate those many leads, generate those many patients requirements. And then of course I have those many physiotherapists will go to patients home and do that, right? So that model has to be proven. So I know at certain scale, maybe 2 visits, 3 visits are happening and it can get to 4. So I leave it at that, then take more areas and do that. Second thing which becomes very challenging in this country is that different cities behave very differently. And especially a newer surveys, the way Hyderabad behaves versus Bangalore behaves versus Delhi behaves is very different, right? And different channels are required to do customer acquisition for a service like this. So look at a Chennai customer, they are not so much driven by digital media. But Bangalore, digital media works very well for customer acquisition, I'm saying. Hyderabad, it works very well. The Bangalore patients are Bangalore consumers are very open to experimenting, trying out new things. Delhi and Chennai, they are much lesser. They need more referrals in Chennai. I'm just giving some examples. But across
So
the country,
in Bangalore, ads can get you the users?
digital ads can get you the thing. But Chennai, a lot of on-ground working will be required because they need referrals, right? They need somebody to refer actually.
They need more trust.
They need more. So they need that level of trust is basically through the word of mouth and not any other way. So there are a lot of nuances like that across the country. And I'm talking of big cities. I'm not talking of like tier 2, tier 3, right? So there's very, very different consumer behavior across the country.
Even in tier 1 cities. Bangalore is very different from Chennai.
It's very different from Bombay, it's very different from Delhi and so on and so forth. So how do you make sure that, and I'm saying mostly from healthcare perspective, how do you make sure that you are getting the right customer acquisition done? How do you manage your CAC there? How do you manage, this is basically on the acquisition side as well as the delivery side. Delivery model you can replicate apart from where the people are coming from. Because Bangalore has a lot of language preferences. Delhi has only one language, right? Everybody speaks Hindi, right? The expectation is that you speak Hindi. But here, if you are going to a 70-year-old Kannadiga woman and who has basically spoken Kannada most of her time and is comfortable in Kannada, you have to have a carer who's speaking Kannada.
Right.
Because that's where the trust, that's where the relationship gets built, right?
Right.
So Bangalore has probably 6 languages you have to take care of. Including Hindi. So you have Tamil, Telugu, Malayalam, Kannada, and of course Hindi also, right? There are 5 languages you take care of in Bangalore. So there are nuances like that in this particular thing. But idea is prove the unit metrics, take it within the city to the next level, then look for similar things as similar as possible, like go to a Bombay or go to Delhi, and then of course from there expand to rest of the places.
There's a lot of startup advice that comes to us from the West. How do these playbooks and this, this written advice land well in India? Does it land at all?
No, I think all advice is useful. Fact is, these playbooks have been created based on some success stories.
Right.
Of course, the context may be different.
Okay.
Principles remain the same. So you have to basically modify those. You have to modify the context and then apply those principles.
Give me examples. What is the principle?
So principle is saying that, okay, I'm take as an example that you should run a profitable business. I'm taking it as an example.
Of course.
Prove the unit metrics first time. Get the right CAC for yourself. Now, how do you implement that in the country, right? So end of the day, any business you build, it's for a one model. You have to generate profit, right? Correct? For any business, end of the day, P&L has to work, right? And then you can work backwards. The unit metrics has to work, and you scale from there, and you go forward from there. So the principles apply the same way. How do you do innovation? How do you make sure that you are taking care of people? How do you make sure that you are scaling business? The core principles will remain the same. Context will be different from the way consumers are adopting the service. Context will be different from the marketing perspective. Context will be different from training and so on and so forth. But end of the principle, any business you run, principles remain the same, right?
Got it.
So all playbooks are useful. I think what we miss out is that we just we try to implement it 100% as it is.
Textbook.
Textbook. So
It's
our
a
point is that
prescription.
you have to continuously modify it. I mean, as I was telling you, within our own company or is within India, the way you approach south versus you approach north versus you approach west or east will be very different.
Right.
So it's no different than I can give a playbook. You're saying playbook from west to east. I'm saying take a playbook from Bangalore to Hyderabad. You have to modify it and implement it, right? So
Got it.
you have to put the context right. So
See, hospital at home is great, but it's only one part of the picture. We do need to look at hospitals and the messy, bulky infra of healthcare. So globally, some hospitals and healthcare experts are rethinking what healthcare means. And we're talking to Mayo Clinic. Mayo Clinic is one of the world's largest healthcare system. So he's talking about what are some upcoming things in healthcare, upcoming for India, but they're actually happening in the world, and how they're changing how care is delivered, and how this is actually opportunity for startups to build in India or any other country. Let's listen into the Chief Operating Officer of Mayo Clinic.
So the three things that I would highlight for you are digital pathology, what we call hospital at home, and then 3, the enablement of AI for diagnostics.
Okay.
So let's talk about, and those are all implementable no matter where you are in the world. So digital pathology. So that is today when you get a pathology sample, like a blood sample or a tissue sample, then a pathologist puts it under a microscope, reads it, and then writes a report, and that gets sent to your clinician. What Mayo Clinic is moving to is, instead of it being under a microscope, it's scanned, and then that image is sent. The image is sent to a server, and then AI processes it for analysis. Just like in radiology, AI has been implemented pretty regularly now. We're going to do it in pathology. So that means scanning everything. And at Mayo, we scan 100% of our pathology slides, and we have scanned 20 million of our historical slides. One example, because then you don't need a pathologist in a remote desert or a remote village. You can have a scanner, which is a lot easier to operate.
It can be done on the cloud.
It can be done on the cloud, but you could have a specialist in Bombay read it and send it back. Right? Because then you can say, oh, this person has a viral. It's actually redefining what a hospital is. So
is it machine or is it the human?
Hospital at home is a combination of both.
Okay.
So it's a historical context. Hospitals were created to control infection. People used to do surgery in the home and let the patient stay in the home.
Right.
But what they found is that there was bacterial and viral issues that happened. So that's why you put patients in a clean environment, and that way you control infection. But the reality is that now you don't need the patient to stay there. You can send them home immediately.
Right.
So Mayo Clinic is doing things like same day, patients that have a transplant, or actually in the transplant case, the next day, you get a new kidney, you're sent home.
The bed is free.
So the bed is freed.
Right.
So for a much more complex patient, you might now have a free bed. And you and I would rather recover at home than in a hospital bed, right? So that's two. So that'll create scalability, right? Last is AI.
Right.
I used an example in there about looking at an ECG waveform that a clinician, the best clinician in the world, could look at it and not diagnose a patient. AI can diagnose a patient on a particular condition. So we have the ability now to use AI to diagnose patients faster, earlier, and on a much larger scale. Then the physician can do the right part of like, okay, now I know the diagnosis, what's the next course of action? So those 3 things, if you're creating new companies or
In India.
in anywhere in the world, but in India, I'm excited about this because we have the best technology expertise with IITs.
Right.
We have the best physicians, and we have an incredible set of hospitals. So the breeding ground for innovation in healthcare in India is better than anywhere in the world.
See, listening into Mayo, you've gotten a sense of how evolved the global, especially the US healthcare system is. But what works globally doesn't work in India, and what works in India doesn't always work abroad. So let's say if you're building something in healthcare that you wish to take abroad as well. The biggest stage obviously is the United States. Their healthcare system is at massive scale. That's where challenge of expanding globally also translates in its scariest and the most challenging form. So we spoke with somebody who's worked with the US government during the Joe Biden era in healthcare. He tells you how Indian founders should think about building products, building medicines, building medical equipment that doesn't just work in India but can also compete globally, get into the US, find a place for itself. Listen into Rahul.
A lot of the entrepreneurs, especially for India, that have in the past spent time and been successful in the United States and other countries, a lot of them is about digital platforms,
Example?
electronic medical records,
Okay.
maintaining the background work that happens in electronically in medical records. Now you have to think about things differently. You have to think about how do you research and develop technology that helps support treatment, diagnosis, and other aspects.
Can I draw you back? So far, it's been about electronic EHR, e-health records, and upkeep of, let's say, clinics, because that's like scheduling, appointment, talking to patients, upkeep. Now you're talking about actually opening healthcare.
Exactly.
Okay.
So think about for the last 100 years, we have been producing medicines,
Okay.
in a way that we use, you'll take 1,000 compounds, molecules. Some of that testing is going to be pretty much in non-living compounds, or you'll run them in a lab, sitting in a lab. Next day, if there's some of them make it through, then you're going to run them into like mice, animals. And then if they make it through there, you're going to look for them for effectiveness, for side effect, for all of those things. Then you're going to make them figuring out, okay, how do we now do human trials?
Right.
Oftentimes, it takes 10, 20, 30, 40 years to bring a drug to the market. It costs over $1 billion for that drug to come to the market.
Startups don't have that appetite.
Right. And not all of them can make money. But startups were not even there in that phase.
Right.
But the difference that is happening today with the advent of artificial intelligence, machine learning, and technological breakthroughs, you can now do all of that in the technological space.
Faster.
But faster, more specific, and more targeted.
Yeah.
And you can work to get it more effective, cost-effective, affordable. And that makes you and your work attractive to people. That's just one example. Same thing when we're dealing with mental health problems or physical health problems. There's a lot of things in terms of apps, in terms of facilitation of tools that are paraclinical tools that can help doctors manage their patients better. Communication strategies that can help talk both ways. There's so much more in healthcare that is open now because of the advent and the forward moving of technological breakthroughs.
Do you have examples? What
Sure.
What becomes the challenge?
Yeah, I mean, a lot of the way the drugs are approved is different in US and different in India. The way healthcare is rendered, healthcare is exclusively just about a private enterprise in US.
Right.
In India, that's not the case all the time.
Right.
A lot of the majority of the population, especially in villages and other places, depends on
Public.
government,
Yeah.
primary care centers, public hospitals, and things
Yep.
like that. So what may work there may or may not work in United States.
Right.
So you have to think through, are you designing your solutions to work in India, or are they also applicable elsewhere? You have to think through that ahead of time.
Fantastic. So These were some real insights from people who are actually in the system, who've actually done it. And, this was for you to learn where opportunities lie. And whenever you're ready, do aim for the global stage. Healthcare is never going to be easy, whether in India or globally. But if you crack it, and if you crack it right, it's one of the most meaningful markets you will ever be building in. So keep building.